Hello, everyone, and welcome back to Mic Check
2.
My name is Rachel.
I'm Sean.
And I'm back. Did you miss me?
All right, Ajai.
Welcome back.
Thanks.
Yes, we were looking for you.
For months.
I've been
For
found.
months.
I've been found.
We are so happy to have you back.
Me too. Glad to be back on 2 feet.
Yeah. Oh,
Back to doing Pilates.
I'm not cleared yet. Mm-mm.
we're gonna have to do a whole deep dive on where you've been, what you've been through.
The recovery process.
Yeah,
everything.
we want to get all in your business on the next episode.
Yeah.
Coming soon. But speaking of being back,
We also have
drum roll. Yeah, we are joined today by Dr. Lynn Roberts.
Hello. That's nurse practitioner doctor.
Oh, put a little.
Razzle Dazzle on it.
Exactly. You want all my credentials?
Yes.
Go ahead, lay them out, Lynn. The alphabet.
So AAHIVM, CDCES, AACRN, FMP. Kind of stop it there, but there's some more.
Okay.
DMP.
The alphabet.
DMP.
The
Yeah,
alphabet.
DMP.
We just need. You're just
MSN.
missing a Z.
I don't think.
I don't know. Well, she gonna create it.
She gonna get it though.
If it's out there,
yeah.
she
If
gonna
It's out
get
there,
it.
she'll
Yeah, I'll have to look at that.
Yeah. Well, we are so happy to have you back, Lynn. And for those who maybe didn't miss that episode, can you let us know a little bit about you? How long you been with St. Hope, and what do you do here?
So I've been with St. Hope now for a little over 7 years. I'm a nurse practitioner, doctorate level, specialize in HIV, diabetes, and family practice. So I also see kids to end-of-life geriatrics. Most of my experience, I have 25 years in ICU and ER, and then I went into primary care when I came to St. Hope, and I did a couple of years in geriatrics.
All right.
Nice.
Speaking of geriatrics.
Don't. Why are you looking at me?
Wait, I missed it.
Speaking, I was going to say,
We're all going to get there one day if we're lucky.
but we don't want to look like we're there.
Exactly.
You see what I
Like,
did?
I did.
You see what I did?
I used my moisturizer, baby. Don't worry.
So today we're going to talk about
the skin.
Skin care.
The biggest organ system of the body.
And we want to sit here and tackle some common questions. We also want to introduce a new service that St. Hope is going to be offering very soon. So we have Dr. Roberts here to fill us in, give us some insights.
The inside scoop.
All right.
well, let's talk about skin types because that's kind of
Yeah, we need to
interesting.
talk about skincare in general.
Yeah, in general.
So probably the most neglected part of the body as far as thinking that it needs some type of daily care. And I think when you're young, we do a lot of the damage. We all want to suntan and be out in the sun and play. Nobody wants to put that white stuff on them, sunscreen, and all. And it kind of stinks when you're a kid. You don't want all that on. You don't want that greasy look. And also we run around without it. So the sun is probably the thing that does the most damage. But also, some people, due to cultural ancestry and hereditary, do wrinkle more than others.
And it's always recommended to, you're supposed to, even if it's not a sunny day, you're supposed to always put sunscreen on your face.
And many of our clothes do and everything. Now, why do you need vitamin D? Why is all these people needing vitamin D? Because we block so much of the sun with our clothing, our windshields, and etc. And sunscreen, the bad side of that is you also don't absorb from the sun what we used to naturally.
So what's like the recommended SP?
I heard it was
SP
30.
30.
Yeah.
On your face, 30.
And many will say, there's quite a discussion about it. Many will say when you start getting into products above 50, for sure, don't pay extra money for it.
You reapply sunscreen
When I'm out.
when you're out?
Like if I'm like out in the sun.
Yeah.
Yeah.
Or
Like maybe the beach or the pool for
like,
sure.
I was gonna say, like, I know a lot of parents, like, if you go to a water park, you'll see them go. The kids will go play in the water. They'll have the sunscreen on already. Then you see it coming off, and I'm like, come here, come on back.
Yeah,
Put
I'll
some on.
reapply like that. But like if I'm
Regardless.
During the day, no.
yeah, like if I'm a regular day and I'm in and out the sun, I'm up at 8. I'm home by 6. I'm not reapplying.
I'm
It
not
breaks down. You have enzymes that break it down. It loses its effectiveness over time.
I did start. I keep some sunscreen in my car to put on my hands. Y'all know the sun be tearing your hands up.
But
And
do you do your lips?
Yes.
That is one of the most sensitive parts of the body that should be done that people often neglect to put sunscreen on.
Yes,
I'm trying to
because
think, do I
I
do
saw
my lips?
somebody sunburn their lips.
How does
I was
sunburn
like,
lips happen?
Never
that-
again.
it will not be me.
Right.
It will not.
No.
Because it's bad. It's
Yeah,
really bad when you.
It's very
painful.
bad.
Yeah.
And it's a very sensitive part of the body.
Yeah,
and
like
it's-
your lips are peeling.
Yeah.
Oh my god.
Okay, so how do you tell what type of? Go ahead, Troy. I'm sorry.
So what about those sunscreens that say they're good for 8 hours?
I wouldn't pay extra money for them.
But do
We're
you
not
think they
pros,
work?
but
No. Yeah.
No, most people, if you read the fine print, it's going to tell you to reapply if you sweat, if you water, or if you're out in the sun. So,
When in doubt, reapply.
yeah, does it maybe work inside a room for 8 hours? Possibly.
With no sun.
but like if we're in Houston
Yeah.
and the sun is just beaming all
Right.
day,
Which it is every day,
All right.
All day.
Monday through Sunday.
basically
No breaks.
6 a.m. to
12 o'clock
9,
a.m.
9
The sun is
p.m.
out even when it's dark outside. It's just hot.
Okay, so I want to know, how do you tell the difference of what type of skin you have? Like, I know there's oily, there's dry, and combination.
Well, and most of us will have all of them at some point in your life. When you're young and you're a teenager and you're struggling, you have oily skin due to the hormones and puberty. You are putting everything on you can, from those old Stridix pads, if y'all remember those, you're probably too young, to just plain alcohol wipes, because alcohol dries. Not a good thing to do, but that's a lot of what we did. You want something to dry. And that's because you're in puberty. So then you go through that, and I would say probably, in my 20s, 30s or so, not counting pregnancy times, I probably had normal skin there for a little bit. Then as you start to hit menopause, now you go to dry skin. So even people who had very oily skin and maybe problems with acne and all, females, as you start to go through menopause, now you're dry skin. You can't put enough Crisco
Moisturize.
on there.
I heard it was better.
I hate
Is it like
glycolysis.
better to be one or the other? I heard it's better to be oily though. Like, because your skin is going to less wrinkle with oily
It
skin.
depends, but it's harder to treat, and then you've got to worry about the acne problems and all. That's
And the
what you're going to have,
follicles.
because you have a little follicle there.
Oh,
Just think of a little pocket, and one of the things with all the wipes and stuff that's out, maybe not the greatest way to wash your face unless you're very conscious about it, you're packing that oil and debris down in that little bitty pore. And that becomes acne. That becomes a pimple. So what you want to do is, when you wash your face, use a cleanser, and then depending on whether you mean to exfoliate with a rough washcloth, or either you mean a more manual method, mechanical, just wipe, and then you want to rinse that off. But just using those little towels and rubbing and packing that debris in, just one of those, is probably not a good way. If you're going to use those, you probably are going to be using more than one, and maybe put some microcellular water on them, etc.
And for some people, like for me, I know I have a mixture. Like my face wise, it's a mix. So
Combination.
My T zone, your T zone, for people that don't know, your T zone is literally like T down. This area is usually my oily. These sides are my dry. So I try to, when I do my little facial stuff, don't judge.
Yeah.
I try to avoid putting excessive moisturizers here and here, because it's already naturally oily and I don't want to put too much, but I'll put it on the sides.
But that's a common myth that you're not supposed to moisturize because you're oily.
Yeah.
You're supposed to apply the same amount of moisturizer even if you're oily. That's what I heard.
You should
Because
use
your skin
3
starts to
products.
overcompensate.
Right. And you should just use 3 products. Make it really simple. And if you ask me like which brand, there's a ton out there, and you can spend a gazillion dollars. You really don't have to. A good cleanser. Okay. I like to think of something like, and I don't own stock in these brands, but like Cetaphil or CeraVe. Because they don't have a lot of extra stuff added to them. They don't have perfumes and all. They don't have
Like the
extra
alcohol.
stuff. Right, and alcohol. So they're not drying, but they're also what we call hypoallergenic, and overused word just mean that they're less likely to have chemicals and preservatives and things that you'll be allergic to. So those are just real simple, basic cleansers and all. And then use a moisturizer and all, and use sunscreen. Now, which moisturizer? Once again, that line of products makes a pretty good one, and you can get them at the shelf brand. If you want to say get a Walgreens or CVS brand of those cleansers, that's great. You don't have to pay a lot of money for it. I would never recommend that someone use things like Ivory and Dial and those types of soaps on their face
that's too
because they're
harsh.
drying. Right. They're
Irish
not
Spring
pH
for the
balanced.
guys.
Yeah.
Guys, y'all know
Yeah.
Irish Spring, I will tell you now, is
Right.
the devil for your skin.
So
when
that
it
means you gotta
leaves
throw
that
out.
thing that you got to drag across, you can kind of feel your hand after you wash your face, though, and know whether you like that. It's a lot about what you like and the results you get. So if you use something, and, you kind of rub your hands and your face feels nice, and you don't see any breakouts for the next week from it, wow, I like this product. It will not be the same for everybody. One person will like one, and one will say, oh, that stuff broke me out. I won't use that.
And it's so funny because now, like, just on like social media, everybody has like a 15-step facial regimen.
I use 3.
You
Three
use
things. Three things.
It's funny she said
What's your
3 'cause
facial regimen, Aja?
Mind your business.
Yeah.
Is it you're closer to the 15 than the 3?
I sure
Well,
am.
What are you putting on?
Well, see-
I'm so curious because
I
know, like-
I like Fenty. I'm not endorsing or anything like that.
I like our products. They're good.
But Rihanna has it's gluten free, it's organic, but Fenty skincare is just
you got some money.
it's not my business. I just said, but Fenty does good, and it's like a nice cleanser. You have a toner, and then you have the moisturizer, and it's just a 3-step 1, 2, 3.
Okay.
But remember toners just in general. You really may not want to use those because they're usually alcohol based or very drying. They were originally drying agents.
you
And
said you. s-
What's a toner?
well, a toner is usually just a clear type of fluid that is usually alcohol or drying based to just kind of wipe your face afterwards. Now, some in Aja's realm, now they have the rose stem cell spritzing. And there are little spritzer sprays for you to use during the day to relax you and refresh you.
Yeah, I thought the toner too was to pick up any dirt you left behind with the cleanser, right? Like to help tone.
Girl, stop
To
looking
even-
over here. Why you asking me?
Yeah. So
Well, I'm asking because you said you had you closer to the 15.
because you would take the toner and you'd put on a little cotton ball and do like this. So if you left stuff there, you would be packing it in.
Oh,
So
not taking it.
if you really want to remove the leftover products on your face, you should be rinsing, not packing and smoothing it.
I use a brightening toner to answer your question.
Oh,
I have I'm that person. I am guilty of the long process in the bathroom. I suffer from acne prone skin.
Yes.
And so I suffer from like hyperpigmentation and things like that. So that's why it's that long. Okay, I'm not one of those, when people are like, oh, I just washed my face and I'm good. Good for you.
Good for you.
Good for you.
Yeah.
I am not her.
I have more hormonal breakouts.
Yeah.
Than like oily skin. So
And for people such as say what Asha's explained when you're looking at acne, you're looking at first you can start off trying the benzoxyl products. There are all kinds of products out there that have that for beginning acne. But when you get into more acute acne or more severe acne, you're looking at things like diphenyl or retinoids, which
Yes.
you probably use.
I am on that.
Yeah, retinol. The retinoids are actually much, much stronger than retinol.
that's becoming really popular, right?
And
Is that what I'm
on
thinking about?
and I'm on a retinoid.
Yeah, yeah.
So what's the difference? One is like
Retinol is
counter-
vitamin A derivative, and it's the lower level. Retinoids is a much more stronger. And what you're doing there is you're treating in the subdermal, so you're treating down in a deeper level of the skin.
like to
But-
stop it from happening.
Right, you do have to watch, and it's very good that she said she uses the sunscreen because what do the retinoids do? They make you hypersensitive to the sun.
Yes.
So she can actually damage and burn that skin much more so than someone who doesn't use retinol products. And retinol is now over the counter. There's still, and then there's Accutane and other pills. And Accutane is kind of a drug that we use to treat acne also.
I
That's
wish
some-
we were able to get Mika on because she know
Yeah.
all the do's and don't products.
Well,
and
and-
she's always like
Right.
encouraging, like start now with your moisturizers.
Yeah, you
Yeah.
really should though.
Oh yeah, I
It is.
moisturize.
And
then
make
you-
sure you do your neck. Let's not
Right.
forget your neck and your ears.
Right,
Okay,
and-
I'm not doing my ears. I do forget the ears, but it's always
come
because
back, Asha.
Yeah.
I'm for real.
No.
Y'all didn't see that picture on social media of that lady who never put sunscreen on her neck?
I didn't see that one, but I did see the truck driver.
Put that sunscreen on your. Bring it down. Bring it down.
I will tell you that probably where I find the most ambiguity or dispute or discussion in the industry as a whole is that you can spend a little bit of money and get some very good effects and protection for yourself versus believing that the only way you can get good skin care, really take care of it, is spend hundreds of dollars. There are products, SkinCeutical and Abanji, and I like both of their products, so I'm not dishing on them, but their serum stuff is $300 to $400 for a little bottle.
It is. That's in my dermatologist's office.
Right.
I'll be like, girl,
right. It's very high.
Next option.
But you can go to, say, Walgreens and go over into their cosmetic section, and there's a couple of lines of products there that are very good. And how I got started on knowing that was actually a SkinCeutical rep who told me, for your patients who can't afford this, you might recommend this. So there are other products that are out there that are very good. When you get into some of the serums, you're getting into whether it's a rose serum or what is the actual stem cell start and stimulator. What you mainly want to look at is things like hyaluronic acid. Hyaluronic acid is something that we use to help bring moisture into and help rebuild the mattress and give us back that nice, youthful look to our skin. If you start now while you're young, hopefully your loss of that natural hyaluronic and collagen and mattress is not as severe as some of the rest of us.
Another part in my skin test. 16. I'm at 16 now.
You just counted it?
Yep.
It's actually like really funny because now I'm going back to TikTok. I'm sorry. They have that filter where it shows you what you're going to look like when you're older. And like all the comments are like, you better start moisturizing.
I love the comments that like show stuff from like the early 90s or the 80s, and it's just like, if you know what this is, you need to have I hope you're using retinol. And it's like, I am, baby. Don't worry about it.
Yeah. So I'm gonna add that one to my.
Some of the things you saw back then that we had we would never use Stridex now. The little pads that had all the alcohol on it.
Do you remember Shardex?
And I hate to say brands, but say a woman would maybe just use Skin So Soft by Avon. Remember that ball of that oil stuff? And they would just lather down with it, just one, at night. And then some women believed in only wash your face with water and a washcloth. Others would use things like Dial, Ivory, Caress. Then Caress came out. Remember how in its ad, it even had the beautiful little stuff. And so you would use all that cologne and perfume in your face.
Oh, no.
Clog up those pores.
That just sounds like
Terrible.
a nightmare.
Yeah. So we look at that, and then and that hasn't even brought into what we used to think about diet. So
now when it comes to diet, I know it can attribute to skin dryness, but there's rumors that it also can cause acne. So in your professional standpoint, when a patient comes in and they're telling you about acne, do you ever ask them, like, what do you eat? So I know it's like high sugars, high fat.
Dairy.
Yeah, we once again want to go to diet. But a lot of this, when you're talking about that, so in the dermatology realm, you think we're talking about skin. But those are the effects of allergies and intolerance in their diet, maybe. So like children who are allergic to milk and dairy products, if they eat the milk and dairy products, yes, they'll probably get breakouts. Will the normal child who doesn't have an allergic issue or who doesn't have an intolerance probably get that? Probably not, unless they're, say, of a puberty age. The feeling isn't that you can connect all that as chocolate, say, which has always been as a causative factor. For some it will be. Some will not tolerate chocolate. But not only do they maybe get acne, maybe they get itches. So it's not just that for you, Susie, if you eat chocolate, you're going to get zits.
Oh.
Because that's what they used to say. Like, they should try to keep you away
that.
from... You're going to break out if you eat that piece of chocolate.
Right. And now, as we've looked at it more, it's not always true. Now, say the child who is allergic to dairy products, say whey, and goes and decides to drink chocolate milk. That child very well may have a breakout. The results of that may show that they could have other problems that they have. I think one of the most important things, though, when we're talking about diet and intake into your skin is going to be going back to what?
Water.
Water. Yeah.
I know people have always said.
So people who have dry skin often aren't drinking very
Enough water.
much water. And they're
water
not
bottles
using
empty.
hyaluronic
Hyaluronic
acid,
acid.
which helps to retain some of that water. So really, once again, you can keep things really basic and simple and low cost instead of, say, buying a certain food that is organic and da-da-da, and I like organic products. Maybe you just need to drink more water.
And I know y'all have heard that little thing, and I'm like, oh, your skin, your complexion looks so nice. What do you do? Drink water. I know people have said that. So
Yeah.
drink
Yeah.
water.
Yeah. When I'm having a good skin day, it's usually a lot of water involved.
And there are things like biotin. Yeah, some of the supplement and the studies do show a correlation with biotin. But does it need to be 10,000 and 20,000 units?
No.
No, it could probably be down more around 5,000.
Yeah, too much biotin.
Yeah.
They'll tear your skin up.
Oh, it'll do the opposite.
Yeah,
It's supposed
it
to
really
do.
will.
Microplating, when you get into a lot of microdermal pinning and all those types of things. Most of those are to do what serum does. And in the sense of that, when I poke little holes in something and run that little meat grinder looking thing, that stimulates the skin to grow some new cells and to grow some new collagen and to fluff and thicken that up. So for myself, I can show you clearly over here, I've thinned out a lot. If I were to do pinning, the microplaning, and micropinning, and we would go over that, and that would stimulate it, and then it would grow new skin in under there. So we want to stimulate something to make it grow. Just like, take a real
add that.
simple example.
Robert.
When
not
you
doing
mow
that.
your yard, does it not seem like your grass grows back real quick for a couple days?
Yeah.
Wow.
You cut it. So if you sit here and you stimulate something, it grows back new stuff. Some people frequently cut their hair, and they'll say it makes their hair grow quicker. And so that's all you're doing with the micro pinning that you see that sometimes is added to other surfaces. And those little rollers that you buy now to use at home. Now you can buy the little
the
thing.
jade rollers
Yeah.
and the aloe rollers.
Yeah, all you're doing
have
is
a jade
sitting there
roller.
stimulating that.
I have an ice roller.
I have a jade roller. It's okay.
I got to step my.
I would not smile.
So I have a question. How often would you recommend somebody exfoliating?
Depends on their skin type. So people who have really dry skin or who have problems with acne
You wouldn't want to.
probably don't want to. And then it also depends on whether you're talking about mechanical exfoliating, like go get one of those cheap washcloths that's real rough. You can do a lot of good work though with that. And or else you can go to a dermatology place and order something that feels like a scrunchy thing for $30, $40. Or you can get the 50-cent washcloth. Then there are chemicals that do it for you also. And you can do even peels and stuff, which don't do them at home if you don't know what you're doing, but you can go and you can get those. Some of them are really cheap or are combined with other products. And they're simply taking that skin off, because what happens when I take it off, like mowing the
stimulate it.
grass, I'm stimulating it to grow new cells under. And that's all serum is trying to do too, is make you grow new cells under there.
And
So
for guys, I know for me,
Normal-
Go ahead.
normally though, how often should you exfoliate? Someone with normal skin and not much problems, probably mechanical once a week.
Yeah, I have.
I always read it was like-
chemical exfoliants in my 16 step.
In your 16-step process?
Yeah.
I use gloves. Have you ever seen the gloves?
Oh, yeah.
They actually have
Yeah.
exfoliating gloves now, so I'll do it like twice a week.
I like the
And-
little.
Oh, you use the.
The spin brush. Make sure you're cleaning that, because bacteria.
I can't do nothing.
Can't do nothing right.
But no, I love my little gloves. But I know I went to a dermatologist and she
I
told me they're
remember.
not good.
The bacteria.
Well, because what I was doing, because I was washing with them every day, because I have like this weird thing about showers, so I would use the
Oh, you were
exfoliating gloves,
over
Yeah.
exfoliating.
and I was doing it literally every single day, and she was like, "You have to stop, because
Yeah.
all you're doing is just drying your skin out faster."
Yeah, in that sense, and he's not getting to get that new skin there. Once you're growing back that new stuff, you kind of want to protect it. So you want to stay with this. So do your exfoliating once a week, and then follow your skin care project.
So if nothing else, we know, drink your water,
Every day. Do your sunscreen.
reapply that sunscreen,
And moisturize.
and mind your business.
And mind your that will really help your skin get great.
Yeah.
And
Got
let's
it.
get back to one of the other things. So when we were talking about the hyaluronic acid and all, that's really great. But maybe that can't do all you need to do to get rid of some of these little lines right here. Wow, what else could we do?
Go ahead, get that little needle out.
Yeah.
Oh, so now-
Fillers. We can do fillers. Now, fillers are really, they're kind of a challenge for me because I'm okay with the mechanical skill of it. I've done this before and I've even retrained now, so I'm okay with the mechanical skill of it. But there is some amount of doing fillers that's really about art. And so people who are really art and who have really good insight and who can see and all are probably really the best people for it. You can get there by training and all, but art still is kind of a certain eye has it better than others. But what part of what you're doing is, okay, you can work out the wrinkles. So places that I have wrinkles, like here on the side of my lips, it looks almost like maybe those lips have turned in a little. Why? Well, if you take this line out here, the lip comes back out. That's just aging. And also, like for myself, if I do that, I have a full lip there.
Right.
But this wrinkle is taken in. So I just put some filler in that little line, work that line out, and I no longer have that. It looks far more useful. Also, you can take and put filler in places and make it turn the light away. So like when you have a ridge or a crevice, you have shadowing here. So you people that are great with cameras and photography know all about that. So this place starts to collect and make a shadow. You look like you have a dark ring under your eyes all the time. But if you put a little filler there, it plumps that up and now it reflects the light.
That's what I know.
Remember the
Girl,
cucumbers?
I want under eye fillers so bad.
Yeah.
I want.
So then you get into really look at that. People who used to smoke have a lot of fine lines on their lips, and they want to take those out. Maybe they quit smoking, but they want to get rid of those smoking fine
It's all
line
those
lips.
years of having no.
Yeah.
Like the
Hold
little-
your mouth a
like
certain
the
way.
yeah.
Yeah, so those muscles, that skin got used to it. It made lines and creases there. Here around under your nose as we get older, we have some. Now, some of what I was talking about here on the side of my jawline where I've lost the mattress. So I've lost the collagen that used to be there, and I don't have that nice plumpness around there. I can put a little there. What you traditionally see is women want their jawline back, though. They want them big cheeks. And Juvederm makes a product called Voluma. I'm not advertising for Juvederm. It's just that's their product. And you can tell sometimes it's a little overdone, so they look like the chipmunks. But Voluma is called the apple in the cheek. It's made to give you back, as you've lost that cheek, that fullness that sets here. And
I think we've all seen it a little overdone.
yeah,
When it
fish
becomes an
lips.
addiction.
Yeah, when it becomes a little too much.
But, and then it's once again, I as a practitioner don't decide how your lips need to look. Who needs to decide that?
Me.
You. You need to decide how much is too much for you and your lips. Different people like different amounts. Some people like a very austere, just a little is enough for them. And they just want a little in their cheeks. And they just want a little bit of Botox here. They don't want their forehead frozen and all to where they have no wrinkles and they couldn't move it up if they had to. Other people want that frozen, shiny, smooth look where there's not a wrinkle one there. Other people want it to where they can't frown.
And they're just stuck like this.
Yeah, but if you but maybe
For the people that don't have YouTube, just know.
Looking suspicious.
Yeah.
maybe you've always wanted that more up brow. I could put a little something there and freeze that brow up there instead of you sitting there 30 minutes with that pencil in the morning and that little stencil and then another little pencil and doing stuff. Maybe we just give you a little bit there and then of course you have to counter it and now that eyebrow will stay up.
Now, Dr. Roberts, you had made mention of Botox. Now, it is so funny that you bring this up.
Yeah.
Because,
Surprise, surprise.
drum roll, St. Hope Healthcare is going to be offering Botox services very soon to all of our patients.
Yes. Exciting to all of our patients.
And this is exciting because it's more affordable too.
Yep, so everybody's eligible.
It gives people access to a product that many people probably thought they would never have access to. And I think it's always sad. I experienced it as a child. Probably will never have access to, a mile-long yacht. So not having things that we think we should have or that others have never feels good.
I had that experience too, Lynn.
Yeah,
No
the yacht.
No yachts.
No
Yeah.
yachts.
No yachts.
But when it's in your day-to-day life, when you're seeing it advertised on TV, when you see it on the news and the media, on TikTok and Reels and whatever else you want, and it looks like everybody else has access to that thing that you think would enrich your physical being some way, but you just are deprived of it. I think that feels bad. Mm-hmm. So I'm really glad to see us to be able to offer this to a larger group of people who probably thought they would never have access to it.
How soon are they going to be rolling out the program?
I think we're starting to make appointments now. We'll be opening it up in the clinics within the next few weeks.
Okay, and will it be available at all of our clinics, or is it just in?
Mainly just 2 to start with.
Okay.
It's you've got the supplies and the refrigeration requirements there. So, we'll set it up at like one of our more northern, one of our more southern, and try to make it as convenient as we can for all.
Now, for those that are not familiar with Botox, we know we heard about it, we know we've seen it on TV, but what exactly does Botox do?
So I'm going to tell you your first and easiest way, if you're just a lay person, a common person, to see who uses Botox and who doesn't. When you watch the news next time, see if the person's eyebrows go up or their forehead wrinkles do.
I've heard that joke before.
Yeah.
No, it's
As
very
he
real.
moves his eyebrows, just so y'all know.
Some people are even frozen, meaning that their forehead doesn't move at all. Some people have a little less. How that happens is that that's a muscle that moves your forehead and your eyebrows up and down. If we paralyze that muscle, it would stop doing that. So like for myself, if I frown, I get these lines right between my eyebrows. And if we want to make me look nicer, maybe softer, if we paralyze those muscles to where they can't do that, then I no longer have those frown lines and I look softer.
Okay, you're saying paralyzed. Is it painful?
No, not at all. Then it is just a simple injection with the smallest of needles, so small that we have to really concentrate to see the point and all, because it's a little bitty needle. We just need something that a little fluid will go through. How much fluid is going through it, how much of that paralyzing toxin are we putting in? Not even a drop that you would drop off of the tip of a spoon would be probably. I mean, it's little bitty. It's 0.1.
I hate needles.
Oh yeah.
So she's looking at me with this
Yeah.
side, and I'm just like,
And I'm just going to be real honest. Sean, you cannot have our services.
I'm not a good
Oh,
candidate.
because he'll move, right?
I've given him the flu shot before. That's just.
It's not a good sight.
But for most people, they really won't know salt. We don't use any numbing agents, even local. We just simply clean and prepare the skin and all. And then simply just the tip. It doesn't really go in the same sense as an injection. Just the tip delivers a little bitty dot. And that's fine. It takes about 7 days for you to see the effects. But in 7 days, you'll see the effects. Many people get it repetitively, like every 3 months and stuff. And they become, very immune where they don't even take as much. That's what professionals do that want to. And even younger people now, we used to think that this was a thing that only old people needed, or people who had wrinkles. But it's really not that way anymore. A lot of people get them because they want to kind of design or contour their face much more than we've thought about in the past.
Now, is there a set limit to the amount of Botox a patient is recommended per session? Like, are y'all only going to be doing, like, let's say I want to just do my forehead, but then I want to do, like, my little crow's feet areas.
We can do both of those areas on the same day. So we would do like your forehead, then we would do your crow's feet, and then probably your glabellar. It's really important to do this part between the nose where those frown lines come. Those are the lines that, especially as you age and all, if you don't use Botox, they're going to get more profound. They get deeper. You begin to make creases there. You've already, when you're young, started to develop creases in your skin, either because of the size of your pillow you sleep on, most dermatologists can tell, or because you frequently smile in a certain way. So around your lips, you start to develop fine creases. As over time, those creases become near crevices. That's what you want to, paralyzing it out.
And I know there's going to be I know y'all are looking at me like, all right. But there's one thing that I know people are wondering.
Yeah, I know. I bet it is.
Patients are going to say, well, you're my regular doctor. How are you giving me Botox? I'm assuming everyone that's giving Botox has gone through
It's a select
trainings.
group, and I was actually trained on this before I came here and did it for a while in another practice and all. So then when I came back here after not doing it for a couple of years, I retrained. And then the other providers that are going to be doing it within our clinics have trained. And we're not just like trained that we, went somewhere and spent a couple hours and all. The group that we were trained by is actually a group that I used before, and they're one of the premier groups for training in Botox, all kinds of different injection processes out of Florida, as we would probably guess. So, they're very used to doing all types of procedures. And we'll even be going back to them just to maybe bring in some other services at a later date. But, it is a skill service. Some are never interested in doing it. Others are interested in doing it.
So how long does the appointment take typically?
It kind of depends on how much you want done. Like Sean was talking about, if you just want the forehead done, it doesn't take that long just to do some small little bitty injections, Sean, injections into the forehead. If you want your forehead and your crow's feet done and your glabellar lines, then that's going to take a little longer. I would say that it's usually going to be around 30 minutes. Yeah. So then when you talk about filler, it may take some. I do want to make a couple of things. So is it covered by insurance? There are situations where Botox can be covered by insurance. You've all probably heard migraines is a common one. It's used off-label for TMJ. But even in those situations, it's not easy to get it covered for that, okay? So you have to have like a headache, diarrhea, and you have to have tried all other things and then failed. And then, you have to pretty well not have dispersed headache zones. You need local ones because that's where you're going to inject. TMJ, it's being used some for that. And then the other places are really places that I would like to see it be more readily available as the sweaty hands. And there are some that have that as a real problem. And you can imagine how that would affect your self-esteem. Even in their work life, they can't touch paper sometimes because their boss has griped down because they get the papers wet when they touch them. We just don't think about the things that food service. Do you want someone to hand you food with sweaty hands?
No.
Absolutely not. I would prefer not.
Yeah. So there are real challenges in their day-to-day life. That takes, though, about 100 to 200 units, about 100 units a hand.
Oh, wow.
And all. So when I'm telling you that it takes, maybe 24 to 30 to do glabellar lines and over your eyebrows, do your forehead, it's probably going to take another 24, and it's probably going to take about 16 to do crow's feet. We're not even got to 100 yet.
Oh, wow.
So it does take a great deal, and it's lots of little injection. But I'd love to see those people who have failed on the other therapies and who suffer with that be able to gain some access to that. It's just still very cost prohibitive. And also soles of your feet. The sweaty feet thing.
That's really nice to know it's not just like all cosmetic. I just learned something.
No,
I didn't know it could help with sweaty hands.
I had learned that my fellow black girls will understand. I don't know if you know if this is true. I heard and I read that you could get Botox around your edges and stop your edges from sweating out.
Goodbye.
I'm a gym girly.
That's like actually really good. Like if you get. So if I went from my little puff to my straight hair, I can't work out because then my hair will go back to this state.
Oh.
So if I get the little...
I'm trying to understand.
Okay, we're moving on. Moving on.
You could get it like around like your hairline to like stop
You probably
sweating.
could, but there's one, if you go over here too far.
No, well, not like.
Yeah. It would depend on...
Baby hair.
And it would kind of depend on the size of the person's forehead. Because remember, we were talking about the forehead. And
Cancel me.
Sorry for you remember. So for some people, have more room for me to do further over here. But remember, if I go over here, very close right in here, I'm going to paralyze the muscle that's bringing your eyebrow up and down here. You don't want to be Spock brow, right?
No, you don't.
Oh, wow.
So if I go paralyzed here, too high, too far over, you're going to be Spock brow.
You want spot brow?
I think I got enough space. Mind your business, okay?
Drink your water.
I think Ajai might be one of those who you could do a little.
Test it out.
something over there.
Let's get it.
Let's run it up.
Coming live. We're gonna go ahead. No, I'm just kidding.
Look.
So I have a question. So I know that it's a good practice to keep the Botox up, like maintain it, like every 3 to 6 months and things like that.
Well, depending on how quick yours uses up. Some people remember, but in Botox world, how long yours will last depends on the brand that's used.
And how
And
much
the
water
brands
you
that
drink.
we'll be using will be not the super long lasting brands, but give you a good lifetime. Okay. And then your body, because it's how much of that enzyme you have that breaks that toxin down, how quick. Then it lasts longer after you've been doing it. So Botox naive people, it's not going to last as long. So like if this is my first or second time, it's not going to last as long, and it's going to take more of it, which is just the opposite, I think, of what we think. But that news forecaster, that forehead has been frozen for whatever, he don't have to get as much now, and he probably doesn't have to get it as often. And when I say he, I do want to differentiate. Men usually need more because it's the strength of the muscle that we're paralyzing, and their muscle's a little stronger. And also, they may need more.
So I guess my question too is also like, let's just say you've been getting Botox for years, like years on years on years, and then you're just like, I don't want to do this no more.
That's okay.
Like, does your face like it's no like side effects? Or are you just gonna like
Does your face
this is
gonna
like
fall apart?
this is like just go droopy? I would just imagine like 2 weeks later,
Don't
after
make me
2
mad.
years,
You know,
you know what I'm talking about? That could be like
You just wake up one day, you're like, oh my God.
you stopped going to Botox, didn't you?
Right.
Didn't you?
that's
Look
the
at
thing.
you.
Physiologically, there's not going to be any recourse or any problems from you doing it. But the people are going to notice and say, what's going on here? You know, I mean, and they're going to be trying to figure out kind of what's going on. What have you changed? And
Not
they
getting no
probably,
sleep.
because it makes you look older, and aren't going to say to you, oh, you look older. Hopefully they're your friends and they know. Where, you know, the inverse happens when you start doing it. People say, oh, what you do? Oh, you know, they don't really know maybe right off unless they're used to it. And they say, oh, I don't know what you've done lately, but you look so good, you know.
I've been working on drinking water.
And
Yeah,
minding
yeah.
Minding
my
my
business and reapplying my
Yeah.
sunscreen.
So I do want to say a couple things. So who cannot get Botox?
Oh, let's get into it.
Okay.
Let me listen.
So-
Hopefully I can.
Pregnant people are not recommended to get Botox.
I can
Now,
make that.
do you
Yeah.
know, do you or
just
I,
snap?
yeah.
Pregnant?
No, I
Oh.
could get it.
Yeah. Do we know of people who are maybe pregnant who ran in and got their Botox? Probably some do, but it is not recommended for people who are pregnant. And part of that is the snot test on people. We don't know the effect, so no on pregnant people. People who have had Bell's palsies or other palsy type situations. So some people have had that, and they would not be a candidate. Because we don't really know what kicks Bell palsies off, and we don't want this to do it. And so then people who have other, like I would never do it to someone who has facial tics
Oh yeah.
and stuff. Then you get into, some people say, well, should the diabetic even have it? Because what do we know? We know that diabetics have more of an issue with infections and those types of things. Yet we all know diabetics who get Botox. So I think it's kind of an explore thing. If it's a diabetic who's always out of control and always has been out of control, and, you know, I'd probably be a little skeptical and warn them, you know, they may have either a more profound reaction or they may have an injection site that, you know, got a more red and inflamed. People with autoimmune illnesses, so someone who has rheumatoid arthritis, someone who has lupus and those types of things, it's usually not recommended. Do you and I know people probably who have rheumatoid arthritis and who get Botox? Probably.
I've learned a lot.
Well, I qualify, so put me in, sign me up.
And I'm sure you guys are going to be screening, so you'll be asking. You'll
Yes.
have a set of questions.
We do, and there's a couple other things that come with that. If you come to get Botox, please don't tell me you don't want pictures. Okay? Because everybody, when you get Botox and when you get fillers, you get a picture. And you want to see the before and after anyway.
Yeah.
Yeah.
And so we do take pictures and we do store those on the computer as a part of a medical record. That's just standard process and all to do that. So if you're one of those who that would be an issue for you, Botox or fillers isn't probably for you. I think just in our clinic, but in any clinic. So
Yeah, my dermatologist definitely. You ready for your picture? I'm like, girl, yes.
yes. So you
They
would
can
get
rub.
your picture, and then we would go through a whole physical screening and all, and look at where you want to be done. Also, we're going to explore with you whether your expectations are realistic, because this is kind of an expectation type service. And
talk
if
to
you think that after one treatment you're going to look like Barbie, probably unreasonable.
Right.
If
Oh,
you're
yeah.
saying, I just want it to make a little difference in a certain areas that I have concerns about or that I'd like to, we're probably your person. And these services are right for you. And
Well, I want to go ahead and start with my smile lines because they smile. They lining. They lining up.
I'll get my forehead. I've had this habit since I was younger. And it started because I didn't want to wear glasses. And my mama caught me, at the TV. It's the baddest
The
habit. I
squinty.
cannot break
squinty.
it. I'm very, that.
bunny lines.
Yeah, so I'm very squinty. So I would definitely.
I'm gonna have to stop laughing pretty soon.
Oh, no, I'm never going to give that up. I'm
So I'm
sorry.
gonna have to just be like,
No.
to keep my face.
No.
So like, this is too much. This is too much. I'm giving you too much. I'm gonna have to.
That's not even funny. Girl, no, I would never be able to do that. No.
I'm gonna start laughing like that. I'm gonna start saying, "Ha."
But I mean, maybe if you start now, by the
Yeah,
time
no,
you're
I'm
like
not-
45, it'll be.
If I could just see me and Troy's faces, we're just looking at each other.
It'd be right.
It wouldn't even be that much.
Yeah, I don't think so. I'm gonna start.
I'm gonna start too.
Welcome
So-
back, Asha.
Look, when y'all see me at my new face, don't be like, girl, what happened? Don't worry about it. Mind your business.
Hashtag.
And drink your water.
Yeah.
You're supposed to say apply your sunscreen.
Oh, and apply your sunscreen.
We
And
each
apply
have
your
one.
moisturizer.
Yeah.
So
There we
coming
go.
soon, we're gonna have Botox rolling out.
And a little razzle dazzle.
Oh, one other thing. So for most people, these services, as I was talking about some insurance, but these services are not going to be insurance-based services. So these will be cash-only services.
You heard it first.
So,
Y'all better start lining
there
up
are
now.
a few indications of where insurance could or would or might pay. Probably most of the time, you will have to fuss and fight for months to get insurance to ever pay for these types of services. Not because they're not effective and all. They're very effective for those few things we discussed and all that are medical in nature. But insurance still doesn't really want to pay on any type of cosmetic or aesthetics.
I was gonna say,
Right.
'cause
And by
it
the
seems
time you
kinda-
fuss with the insurance, you're gonna get
You got
another
some more
wrinkle. You might
wrinkles.
as well just pay for it.
Yeah, because that you stretched yourself out.
Save yourself some money. So, but we will have, I won't say competitive. I think these prices will be lower than anything you'll find. That's the thing. They're not just competitive in that they're what other people's are. And they're the absolute lowest that we can make them and still make them available to people. This isn't something that we're doing to make big money off of our population. It really is a thing of offering these services to people who maybe didn't have access to them before,
I love that.
That's beautiful.
which is what we'll continue to do at St. Hope Healthcare.
So just make sure if you're
that's right.
interested in Botox services, talk to your provider, see if you do qualify, see if they're able to work with you, and schedule your follow-up appointment and go from there.
Where can they schedule this appointment, Sean?
They can schedule this appointment at offeringhope.org or by calling in at 713-778-1300. And before we go, did you have anything that you wanted to throw in there one more time? Or?
No, I would just say, that skin is probably the most neglected body system. It is the biggest organ system of the body. So drinking your water using a sensible cleanser, moisturizer, and sunscreen when you're out in the sun is the most important things you can do. And if you're not doing those foundation things, then probably don't need to go to that 16 product of Ajai's, because I see people who will use serums and pay hundreds of dollars for those products, but probably don't wash their face in the morning or at night.
Yeah, you gotta wash your face. Don't be coming up here asking for Botox and you not even washing your face every
Step
day.
one.
Like, step one, let's just
Cleanser.
Y'all,
And you don't have to spend a lot to take care of your skin. That's the other thing. I think, the industry or some have kind of made it seem like it's really costly to do good skin care. It's really not. It just takes a little bit of time and common sense.
and some consistency.
Oh, yeah.
True.
that word.
I like that. Well, thank you so much for joining us, Lynn.
You're
we really
welcome.
appreciate it.
And always remember, here at St. Hope Healthcare, you're more than just a number.
Hey.